Hi everybody, Dr. Vito Spadafino here, and today I want to talk about constipation, both in adults and very commonly we see it in children and babies as well. So I want to talk about the neurophysiology of that process and how that can link back to the spine, and we can help that improve with chiropractic in many cases. So if you watched some of our previous videos, we talked about acid reflux last week and the importance of some of the smooth muscle contributions. So what are those muscles controlled by? Well, there's one key muscle called the vagus nerve I've mentioned a number of times. It's a cranial nerve that starts up here, then travels through the thorax all the way down to a lot of different visceral organs, okay? Now, you have muscles in your body that you can contract voluntarily. Those are somatic muscles. Then you have smooth muscles that are involuntarily controlled. So you can't think of them to constrict, right? But those smooth muscles are controlled by those autonomic nerves, one of which is the vagus nerve. So the way that food moves through your digestive tract is you swallow it, right? It goes down your esophagus. About halfway through your esophagus, the muscles turn from voluntary to involuntary, and then it's involuntary the rest of the way down. But there are these concentric muscle contractions that kind of push the food bolus down lower and lower, right, through the digestive tract. This is very important to keep food moving through. Now, if we don't have those proper contractions, now the food kind of slows, the process of motility slows down, okay? So our goal is to have proper smooth muscle contractions moving the food down. When we have a lack of nerve flow, that can get stopped up, particularly in the lower parts. So when it comes to assessing the nerve function there, we want to look at both ends, right? We want to look at that vagus nerve stemming from the top of the neck there and the occiput. But then we also want to look at the nerve supply down through here as well, the sacral plexus going to the large colon. So when it comes to constipation, oftentimes we're looking at the top and the bottom of the spinal alignment to make sure there's no unnecessary nerve pressure. On the other hand, in terms of just function, right, or content, with what we eat, you want to make sure that you're drinking lots of water, that you're having adequate amounts of fiber to keep the content of food in your digestive tract so that things can move through, right? On the last piece, if food does not move through properly, that's also going to affect the absorption of nutrients, and so certain nutrients are not going to be able to absorb well. You're also going to have food be backed up in your colon, which can kind of rot and infest and cause other kinds of problems. So it's in your best interest to keep food moving through properly, and the best way to do that is make sure that you have proper nerve supply to your large intestine. This goes for adults, but even more so for children. What's fantastic is anytime in chiropractic, when we take care of babies, their bodies are so much more responsive because there's less in the way and they're just wired for that kind of neural connection to be reestablished. So there are many times in our office where we'll adjust a baby that's constipated and they'll have to poop before they even leave the office. Some of our doctors are called the poop whisperers because of this. So, and in those cases, very commonly, it's when we adjust the upper bone in the neck or the lower bone of the sacrum there. So if you know somebody that's struggling with this issue, I'd encourage them to have their nervous system checked by a chiropractor so we can assess that relationship and make sure that their body's doing everything it should. Thank you.